Ghana was the world's first recipient of the coronavirus vaccine from COVAX, a scheme that aims to ensure vaccines are shared fairly among all nations, rich and poor, to curtail the spread of the virus. The scheme is co-led by the World Health Organization, the Global Vaccine Alliance, and the Coalition of Epidemic Preparedness Innovations, with the UN Children's Fund, UNICEF, as key implementation partner. As of April 8, 2021, more than 38 million doses of the vaccine had been delivered to 98 countries. Health experts say equitable global access to vaccines is crucial to ending the pandemic. After Ghana received the first shipment of 600,000 doses, eligible recipients of the vaccines were categorized into 4 groups under a national vaccination plan. The first to be served included frontline persons, including healthcare workers, security personnel, and some civil members of the executive, legislature, and judiciary branches of government. Some Ghanaians had safety concerns about the vaccine and feared to take it.
I've been fire. No, if it's a me more paneda. If it's a me nana no yadimeton no ebi bidro. Entino sabi bidro no an anything bia no me fa. Me hu say mo meti say ale na ba no an me fa.
Okay, so what you also won fa kra.
Dabi.
Yale no so unsro.
Oh yale dem so yale no. If say anything bia me na mo a me no smart in there. O me home so abi bidro ho a me ye dem me use. If they were me call hospital, be more panier so that.
Oh, there be vaccine lenko because in here wale. No efe me. At the same time, always second talo le me in protecting he. Can you share in sanitize and cafe in the infondi? No fear no yana pepe. Oh, I'm okay.
On March 1, 2021, President Akufo-Addo, together with his wife, publicly took the first jab of the vaccine, along with the Vice President and other state officials, to encourage the public that the vaccines were safe.
It's important that I set the example that this vaccine is safe by being the first to have it, so that everybody in Ghana can feel comfortable about taking this vaccine. It is important that everybody, at the end of the day, is vaccinated, and that's our objective.
We ask for your patience, we ask for your cooperation as we go, but please don't listen to the naysayers who want to spread conspiracy theories about this vaccine. As the president said last night, it is not going to change your DNA or have all these effects that they are talking about in the conspiracies. Please, this is to protect the health of our people.
After the first batch of the vaccines were administered, each individual was given a card containing details such as the date when the vaccine was administered, personal details, and a scheduled date when one can take the next jab in at most 8 weeks. Weeks later, Ghanaians who had received their first jabs were expected to be given their second doses after 8 weeks to complete the full vaccination process. But the Ghana Health Service indicated that the initial vaccination policy for those who had taken the first dose to receive their second jabs in 8 weeks had now been extended to 12 weeks instead. Ghana's major exporter of the vaccine, India, has cut supply of the AstraZeneca vaccine to Ghana and other countries as it struggles with a spike in the rate of COVID-19 infections. India, at a point in recent times, recorded 50,000 new infections in a day, forcing the government to halt supply of the vaccines. Some Ghanaians, however, say there is hope that the government will procure the next batch of vaccines.
No, biomethod should be around. If it's not around, how do you take the second dose? You always need the second dose for it to work effectively. So if you've not taken it, why will you know that the already one you have taken has worked or not? So I'm very sure they'll bring the second dose for us to take. But I don't know whether if the time has passed for maybe 2 weeks or 1 week, when you take it again, it will work or not, but I'm sure it will work. So if you come even after my date, it's okay.
One thing I know for sure, it will soon come. Yeah, I have hope. Maybe the vaccine will soon come, because I know 2 or 3 people who went for the vaccine But they tell me they've taken the vaccine and I've seen their card truly. But for me, I hope the vaccine will soon come.
The program manager, expanded program on immunization at the Ghana Health Service, Dr. Kwame Amponsa Achiano, in an interview with Citi News, announced that the country will receive over 300,000 doses of vaccines this week.
The new evidence suggests that if you give it 12 weeks or soon after is the best. However, 8 to 12 weeks is still an optimal period. And we are hopeful we are getting some vaccines even this week. And we would definitely start with those who started first. But your substantive question is, if we don't get the vaccines before the 8 weeks, we are already in the 8 weeks and we know we are getting some vaccines, but it doesn't mean that the vaccines will not be useful. And so come next 2 weeks, we'll start some of the second doses for the general public or those who have already received.
He confirmed that the vaccines will be imported from the Democratic Republic of Congo under the COVAX initiative.
This particular one is coming en route from DRC. It's already put out. I think it was on the African Vaccination Week celebration, the launch. Somebody put it out, and it's actually confirmed. So we are confident that today or tomorrow we'll receive those vaccines. But it's still COVAX. Within COVAX. Then again, it's delayed a bit. We knew that because of the global issues around the vaccines. And it's not within the countries, as it were, control. And when you don't have control, you only pray. And that the rest of the world supports everybody.
But what's the government's plan for the next batch of COVID-19 vaccines? Because
we are limited by the supply of vaccines, people are still threading cautiously. That is how come people are so anxious about the second dose. So UK has shown the way that if you give more people first dose, you are likely to also reduce the impact. And that is why their hospitalization rates, everything has gone down and they've opened up. And so back to the question, if we get few, then obviously our attention will not expand because it will not be, practically sensible to keep on expanding. We'll focus on the second dose. But if we get more, then obviously the expansion will come in.